let's jump right into something. So let's talk about lateral flow immunoassay, LFAI. For short, this is basically the science behind most of the rapid tests we use, whether it is for pregnancy, malaria, HIV, COVID, or even drug tests. So how do they work? Let's talk about how they work. Very simple. A liquid sample, maybe blood, urine, saliva, or serum, flows across a paper-like strip, right? So on this strip, we have got antibodies or antigens already fixed in the place. These capture and reveal whether the target we are looking for, what we call the analyte, is present or absent. So what really is an analyte? The analyte is just the substance of interest we are testing for. For example, hepatitis B surface antigen in blood is an analyte, HCG in urine for pregnancy is an analyte, or amphetamine or morphine or THC in urine is an analyte, right? Now, this strip isn't just ordinary paper. It is engineered in layers, right? First, the sample pad. That is where you drop your sample. Then the conjugate part. It carries dried antibodies or antigens that are tagged with visible labels like the colloidal golds, the lattice beads, or even fluorescent tags. Next comes the nitrocellulose membrane, which has two important lines. We talk about the test line or the T line, which is coated with capture molecules to detect your analyte, and then the control line or the C line, which just makes sure the test is flowing correctly. Finally, we have the absorbent part, which helps pull the liquid across by capillary action. So what's the principle behind lateral flow immunoassay? It simply comes in two forms or two flavors. We talk about the non-competitive or the sandwich, and then the competitive assay, right? Let's jump right into the sandwich or the non-competitive assay. Here the test line is coated with a capture antibody. The conjugate part carries the labeled antibody, which I have explained earlier. So when the sample runs through the analytes, when the sample runs through, the analyte, say the hepatitis B surface antigen, binds to the labeled antibody, forming a complex. That complex gets trapped at the test line by the capture antibody, and boom, visible line shows up. So in this format, if you are interpreting the positive result, two lines appear. You talk about the test line and then the control line. If you are interpreting a negative result, only one line, which is the control line, appears. If there is no control line, then you know that the test is invalid. Now let's talk about the competitive assay. This one flips the logic. Instead of capture antibodies, the test line has an immobilized antigen. So the conjugate part carries labeled antibodies. Now, if the drug, say morphine, is present in the sample, it binds to the labeled antibodies, preventing them from attaching to the antigen on the test line. So the more drugs in the sample, the weaker the test line. Here, interpretation is reversed. A positive result can be interpreted as only the control line visible, and then a negative result will show both tests and control line. So here is the hack. Antigen detection like hepatitis B surface antigen, the P24 protein, the influenza protein, they all use the principles of sandwich assay. And then when you talk about the antibody detection, like the antibody to hepatitis B surface, antibody to HIV, antibody to hepatitis B envelope, IgG, IgM for touch, all usually use what we call the competitive assay. So small molecules like drugs or hormones, competitive assay too, because they are too tiny, to form a sandwich. Now, let's look at some of the real life panels. You've ever seen, the hepatitis B 5-panel test, right? There you have the hepatitis B surface antigen, you have the antibody to hepatitis B surface, you have the hepatitis B envelope antigen, then you have the antibody to hepatitis B surface, antibody to hepatitis B envelope, and then you have the antibody to hepatitis B core. Now, let's look at them one after the other. The hepatitis B surface antigen is sandwich in nature. The antibody to hepatitis B surface is competitive in nature. Hepatitis B envelope antigen is sandwich in nature. Antibody to hepatitis B envelope is competitive in nature. And then the antibody to hepatitis B core is competitive in nature. So that's about the hepatitis B5 panel. So on the same panel, you can have, two lines appearing or being interpreted as negative and then one line as positive, right? Now let's talk about the HIV fourth generation combo test. Here we talk about the P24 antigen, which is sandwich in nature, and then the antibody to HIV antibody is competitive or indirect ELISA in the lab format. Then we jump right into the drug of abuse panel, which could be, the 5 panel, the 10 panels, or, the 10 or the 12 panel screen, right? All are competitive because drugs are small molecules. For example, the THC, cocaine, opioids, amphetamine, benzodiazepam, they are all very minute in nature. So they are exclusively competitive in nature. Now let's talk about respiratory virus multiplex tests, like the flu A, the flu B, the RSV, the COVID-19. These are antigen based, so they use the sandwich format. What about the touch panel? We talk about the toxoplasma, rubella, CMV, and then the HSV. Like the IgM aspect of the touch is sandwich in nature, and then the IgG is competitive in nature. So bottom line, lateral flow immunoassay is all about antigen versus antibody versus small molecules. And knowing which format is used helps you interpret results effortlessly, right? Thank you.